Good morning, afternoon, or evening, depending on where you are in the world. Welcome to the 2022 EHE 360 International Conference Patient Day. My name is Jenni Kovach, and I'm the president of the EHE Foundation. I'm also an EHE patient myself, so I am double excited about today. And I want to thank everyone for your attendance. The EHE Foundation is a US-based nonprofit that was formed in 2015 by a dedicated group of volunteers. We have one goal: to find treatment and a cure for EHE. Together with the partnership of the EHE Rare Cancer Charity UK and the EHE Rare Cancer Research Foundation Australia, I'd like to welcome everyone to the 2022 EHE 360 Patient Conference. Today, we bring together in one virtual room patients and medical professionals from around the world for the first time ever. All right, so in our patient conference today, we have three goals. We have educate, we have innovate, and we have collaborate. And when I'm looking at the attendees and the number of people that are joining us today, I have no doubt we are going to achieve these goals. I want to take a moment and say a sincere thank you to our co-chairs of this conference, Dr. Rubin, Dr. Stacchiotti, and Dr. Tapp. We so appreciate your insight and your time and support in designing this conference. Okay, a little bit of housekeeping to get us started this morning. You are currently on the 360 event site. It's pretty easy to navigate. Don't worry, you won't break it. Look around, click on things, check stuff out. A couple things I want to point out to you. On the homepage, if you scroll down, you're first going to see our sessions for the day. You'll see some speaker information, and at the bottom, there are some patient videos. Please take a moment and watch these. They are awesome. Across the top, you're going to see a little button that says attendees. That is, when you click on that, you're going to get a pop-up that says, allow your profile to be visible. Please do so, because this is how attendees can direct message you during the day. If you, by chance, have anything pop up today where you need help, please go to that attendees and click on Maida Dioris Sutliff. She is our executive director of the EHE Foundation, and she is there today to help troubleshoot. So our agenda today, most of the sessions will be panel discussions immediately followed by a moderated Q&A. Once you're in a session, you're going to see on the right-hand sidebar a Q&A function and a chat function. Please ask any questions in the Q&A function, and then the chat function will be where you can communicate with all other attendees. All right, so talking about Q&A. Let me introduce to you our moderator. If you were in attendance at the conference last year, you might remember David Casimir. David is a board member of the EHE Foundation, and he brings so much expertise to our community. I am thrilled that he will once again be guiding us through these Q&A portions of the day. All right, so today is interactive. Please don't hold back. There are so many ways that you can participate today. As mentioned earlier, you can use the chat in the right sidebar just to comment and have conversation throughout the day with all attendees. You can ask questions in that Q&A sidebar, and you can connect by messaging people directly. So we can only make these conferences better in the future by providing, if you give us feedback. So there is a feedback survey button on the homepage. Please provide us feedback. And then let's make today social. There are a number of us on this conference. If you want to post to social media, hashtag EHE360. Let's try and take over the internet today. We also have an Ask the Expert session at the end of the day. This is going to be amazing. I cannot wait for this part of the day. The one thing I do need to mention, though, is with so many ways to interact, it's important to remember that today is for the benefit of our entire EHE community. So we do have to ask that you please refrain from asking personal medical questions. and really ask questions that can be helpful to the community at large. And so with hundreds of people registered, we want to keep any private health information, well, private. So before we get started, wanted to just say a special thank you to our sponsors. Ikena Oncology is our main sponsor for the day, along with Every Life Foundation and the Cleveland Clinic Sarcoma Program. And I would be remiss not to mention Chan Zuckerberg Initiative, Rare as One, who has been instrumental to the growth of the foundation over the last couple of years. All right, so let's get this party started. It is my honor to introduce Hugh Leonard, Chair of Trustees with the EHE Rare Cancer Charity. Hugh is a wonderful partner and friend, and he is instrumental in helping move EHE research collaboration forward. He is also the superstar who keeps all of us in the community updated with our beloved newsletter, The Pledge. Please welcome Hugh Leonard.
Well, wow, Jenny, thank you for that lovely introduction. And I just want to say, as you did, Jenny, welcome to everyone, wherever you are on the globe. I think it's quite amazing to think that we have patient members in 77 different countries, and we may have people watching this today on every continent on our planet. So that is extraordinary. Welcome. It gives me huge pleasure to start this session by introducing a very special person, a champion of EHE and a friend of our EHE community. Dr. Silvia Stacchiotti is a clinical oncologist specializing in sarcoma at the Istituto Nazionale dei Tumori, or INT, in Milan. In addition to her clinical work, she is driving force behind sarcoma research at ENT and actually is playing a key role in our expanding EHE research in Europe today, for which we thank her. She's been very active, as always, in improving the clinical care for her patients, and was one of the driving forces, in fact, in the understanding and acceptance of sirolimus, for example, as an accepted treatment for EHE, which many of our patients are seeing good results from today. In her clinical role, Dr. Stacchiotti was very aware that there were no accepted guidelines or protocols addressing EHE in its clinical treatment. And so in late 2020, she decided to do something about this. And under the auspices of the European Society of Medical Oncology, or ESMO, Dr. Stacchiotti set about changing the situation, organizing and chairing a major consensus initiative. And we are thrilled to have her here with us today to tell us more about that and the benefits of it. So Silvia, the floor is yours.
Thank you very much. Let me just... Okay, so good day to everybody. I really want to thank you for this awesome presentation. And of course, Jenny, Dennis, David, and all the EHE foundations and all patients who made possible this event and are working in collaboration with us, the physicians, to try to improve treatment and care of patients affected by epithelioid hemangioendothelioma. I am really glad and honored to be here with you, and I'm really aware that without you, many of the things that have been done and will be done will not be possible. So I really want to start by thanking everybody for the collaboration and the consideration. This said, we are going to take some minutes to discuss together about the epithelioid hemangioendothelioma consensus paper. These are my disclosure. And I would like to start by trying to share why we thought that having a consensus paper about epithelioid hemangioendothelioma would have been so important. First, we wanted to focus on the clinical approach to epithelioid endothelioma, even though we know that preclinical stuff and science are so important to move forward and to develop new compounds. It is very, very important for us to try to define which is the best approach to the disease. In fact, epithelioid hemangioendothelioma is an ultra-rare tumor in which the scientific evidence supporting the daily practice are less than we have for more common cancer type, and for this reason the approach to patient varies a lot across countries with a lot of disparities. So what we talk as a sarcoma community was that it would have been very important to try to harmonize the approach to the disease, and thanks to the collaboration with the EHE Foundation, this was possible. And I think that this is also representing a model for other ultra-rare sarcoma. To meet together and discuss about the clinical approach and the data that we have to support daily clinical life is also important to identify which are the open questions to address with new studies, with new research. In addition, to have a common document drafted with the community of physicians and patients all together provide us with a very important tool that can be used to improve the interaction between us, the community, and the pharmaceutical company and regulators, to be able to show them which are the characteristics of the disease, which are the challenges, which are the data that we already have, what we can do and what we cannot do as a community based on the rarity of the disease. So on this basis, we organized on the 4th of December 2020, due to COVID, a virtual workshop, thanks together in collaboration with the European Society of Medical Oncology, but also and especially in collaboration with the EHE Foundation, the UK and the US group. And what we wanted to have was a large group of physicians and researchers with expertise in sarcoma, coming from all the disciplines that are involved in treatment of epithelioid hemangioendothelioma patients, since we cannot treat the disease outside a multidisciplinary collaboration. And we try to be inclusive and to collaborate together. And for that reason, we try to involve the larger group of institutions we could. I also want to clarify that initially, we thought to have an in-person meeting, and due to the limitation in terms of funding and possibility to travel, we focus more on the US and the European groups. But this does not mean, of course, that for the future, the idea, the intention is to work together with more countries from Asia, from Australia, or from all around the world. This said, we had more than 80 experts from more than 20 countries, from Europe, North America, and Asia, working together on the paper, representing 11 different disciplines, from basic science to epidemiology, pathology, radiology, surgical oncology, radiation oncology, medical oncology, pediatric oncology, and palliative care. And together we wanted really aim at having the perspective of patient, and for that I really again need to thank the EHE Foundation and also the other group which work with us, that is SPINE. This is a very virtual picture of all those who participated to the meeting. And which method we follow? Initially, we together look at the available literature, and since several data to discuss together how to approach the disease were not available, to prepare the meeting in the best way, we also started some new data collection in terms of data on the systemic treatment, data about symptoms, prognosis, and this was done really thanks to the collaboration with all the researchers and institutions who work really a lot for that. Then we drafted the first manuscript before the meeting. This manuscript was circulated, and then the draft was reviewed all together during the main virtual meeting on the 4th of December, focusing especially on the most difficult point to agree upon. Then after the meeting, all was incorporated into the new draft. There was a second round of discussion conducted by email, and during that final part of the work, we also added to all the statements the level of evidence and the grade of recommendation, as we do, for example, for the ESMO guidelines for treatment of tumors. And finally, once the agreement of all the authors was there, we submitted the patient to ESMO Open in May 2021. And in fact, the paper was accepted, and also again, thanks to the economic support of the EHE Foundation, the manuscript can be downloaded for free by everyone who wants to look at it. And I think that this is very important to try to spread what the community address all the main aspects related to the treatment of the epidemiology, general principle for the management of the disease, pathology, molecular biology, radiology, including response assessment, diagnosis, and treatment in terms of surgery, radiation therapy, and systemic treatment and palliation. And of course, also how to follow up a patient at the end of their treatment. Let's go quickly into the main statements that we could agree upon starting from the introduction. Sometimes, to forward the research and care of the disease is important to start by using the same words to define the disease itself. And I think this is the case in which you have systemic metastasis. This classification was very important to try to conduct a good discussion. Then, of course, we agreed about the fact that the relative incidence of each of these presentations is still left to be defined, and we hope that future registry will help us with this. Then we move to discuss prognostic factor, and even though there are limited data, the group agreed upon considering the disease extent, presentation, the presence of systemic signs, and the presence of effusion as three signs of very important to define the prognosis, even though we are still missing pathological prognostic factor, and we still, of course, need to refine much better how to understand which is the prognosis of the disease. We all agreed that the clinical behavior of EHE in the metastatic setting can be very variable, from a very indolent disease to a very aggressive tumor resembling an high-grade sarcoma. And we also agree that it is important to have the confirmation of the diagnosis in a center of expertise where there is a pathologist with a specific knowledge of this kind of tumor. And this was a hot point. At the end, we agreed that the gold standard is to have the pathologic diagnosis confirmed by the presence of the specific molecular alteration, the translocation that can characterize the disease. Then we thought about the relevance of the radiologic assessment, including also an assessment of the bone. We then decided to discuss a little bit about a critical aspect, which is how to assess response, and this point is still left to be defined, and we hope that future meeting will provide more discussion about this. And then in terms of treatment, we approach the disease in case of unifocal presentation. In that case, the complete surgical resection with negative microscopic margin is, of course, the standard treatment that can be complemented by radiation therapy. In case of difficult allocation, surgery unfeasible, very important to agree that active surveillance in case of primary localized EHE has to be considered only for a patient that cannot tolerate the surgical resection. Of course, the surgery must be performed in center of expertise. Then the discussion was conducted taking into account the site of origin of the tumor, with some discussion about the role of liver transplantation. This was also a very important point. Then we discussed how to approach the metastatic tumor, underlying that it can be important to have a period of time dedicated to active surveillance, and then to consider a systemic treatment when there is evidence of progression or when there is a worse presentation with the serosal effusion and symptoms. In terms of systemic treatment, we all agree that conventional chemotherapy is into clinical study, and then we suggested a list of potentially active drugs, most of them unfortunately not formally approved for treatment of the disease. Then on this basis, was very important to underline that for the future, further new compounds and new studies are needed. We underlined also the importance of palliative care and treatment of pain, and to refer patient to a specialist in set. And there is also in the paper a very important final paragraph in which we discuss about future perspective. In particular, we say as a community that is very difficult, if not impossible, to conduct randomized study. We underline the importance of patient registries, and we underlined the importance of global collaboration is so important in this respect. So now that we have this paper, it is important that we spread it among the physicians, oncologists, by means of patients affected by the disease. In this regard, a live version for patients to be translated into different languages is almost ready, at least in its English version, again, thanks to the support of the EHE Foundation. Then as a community, we want to continue working together to maintain and develop a always improve consensus approach to this tumor, including, as said, a better definition of how to assess response. We are working together to set up a prospective registry, and we also want to work together with all the other groups affected by ultra-rare sarcomas to promote these very rare entities, especially in the discussion, being here together today for giving us all the support that we need and for being so much instrumental in improving the knowledge and the care of our patient. So thank you very much again.
Silvia, thank you very much for that presentation, and I really think that the consensus paper is something that you and your team should be extremely proud of. I think it's the only document of its nature that I'm aware of in the world, so another first for EHE. If I describe Dr. Stacchiotti as a very bright light in the global sarcoma community, then I have no hesitation in saying that our next speaker's light burns just as brightly. Professor Robin Jones heads up the sarcoma team at the Royal Marsden Hospital, and he also holds a senior position in the Institute of Cancer Research next door to it. He holds multiple positions in different patient and clinical sarcoma groups in Europe and internationally. He is very definitely a champion of our EHE initiatives, and just like Dr. Stacchiotti, Professor Jones is playing a key role in expanding our EHE research in Europe. He was a key participant in the development of the consensus paper that Dr. Stacchiotti has just been talking about. And so we were delighted when he said that he would be happy to take part this morning and provide his personal thoughts and observations regarding the clinical importance of the consensus paper. So Professor Jones, the floor is yours.
So thanks very much for the kind introduction. I'd like to start by thanking you for the invitation, and it's a real pleasure to join all of you today. As Hugh knows, I think it's a real honour to work with you. Hugh and I have worked considerably over the last few years, particularly with my colleague at the Institute of Cancer Research, Paul Huang. And I'd like to thank all of you for your support for the consensus statement, but also for research in EHE in general. Thank you to Jenni and the team, and also to the Australian group. So it's a real honour to be here. It's also great to see my friend and colleague Silvia Stacchiotti, and thanks for your excellent presentation, Silvia. I'll tease Silvia a little bit and say that I've got very little to add to her presentation, because we usually agree on most things. But I'd just like to give some thoughts about the consensus statement, and these are very much my personal view of the importance of the manuscript. So those are my disclosures. And as Silvia mentioned, I think one of the sort of really key things about this is that it brought together all our knowledge of epithelioid hemangioendothelioma. It was a very collaborative group, very multidisciplinary, And I think one of the major things, it allowed us all to share our knowledge and opinions about this disease and essentially provide a platform to plan for the future. I think one of the most notable things is that a lot of the studies that were used and incorporated are retrospective, but I hope with time that we'll be able to do more prospective work together in registries, but also in prospective clinical trials. And again, Silvia and Hugh have really highlighted this, that the consensus provided a benchmark for future research, identifying gaps in our knowledge, and providing, again, a platform for future translational research, but also for prospective trials. And importantly, it brings together all available information on this disease, which is really important when we're having discussions with regulators in terms of the design of clinical trials, but also in discussion with pharmaceutical companies, also in discussing investigator-initiated trials or pharmaceutically sponsored trials. I think that the fact that all this information is provided in one very clear and concise document is important also for other doctors that may not be familiar with this disease and may only see one patient with epithelioid hemangioendothelioma during their career. And again, the fact that this is an open access document, thanks to your support, is just wonderful. It means that doctors elsewhere, when they see a patient for the first time with EHE, have a valuable source of information in one document. And I think in many ways it provides a basis for them to be able to contact referral centres and to instigate that relationship in terms of managing patients. And as Silvia mentioned, the importance of getting the pathology review to confirm the diagnosis. And I think this is particularly important for community oncologists in the United States, but also for regional hospitals in many parts of Europe. Again, the access to this concise document is very useful for doctors in training and highlights the importance of discussing with experts the management of patients with rare diseases and actually tailoring therapy to an individual person. So I think all of these things really do highlight the positive impact that the consensus manuscript has. So as Silvia and Hugh mentioned, we clearly need to improve our knowledge of EHE. I think the structured approach in the consensus manuscript is fantastic. This disease, of course, can have a very unpredictable behavior, and having a statement like this is very important in that context. As Silvia mentioned, the future perspectives section, I think, is very, very important for us to move forward in terms of improving outcomes for patients. And Silvia also highlighted the importance of prospective data collection, and we're working on a number of projects in this regard. And we also have a section on biobanking later on. And these two things, the collection of data, but also the collection of tumour material, I think is really, really important in terms of us identifying predictive factors of benefit from treatment, but also hopefully identifying targets for new treatments in the future. And I think one of the major things that I emphasize and like is the collaboration between regional and experienced referral centres, that communication is open and flows smoothly, so that doctors in regional centres feel easy with communicating with sarcoma doctors in regional referral centres. And this is obviously important if we are going to conduct more prospective clinical trials in EHE. And I've underlined the last point here that patient involvement is essential, and you have all done so much in terms of not only the development of the consensus statement, but also highlighting the importance of research in this disease. And like to say thank you again for all the support. So unlike some of my presentations, I think this is relatively short, so hopefully nobody's fallen asleep, but I'd welcome any questions. And I think that really is the important part of this, this meeting today. So thank you again.
Robin, thank you very much for that. That was fantastic. Silvia, I see you're back in. Have we lost Robin? Robin,
yeah, Robin, please do join us again.
Yeah, stay in for the Q&A. That would be brilliant. And listen, today, as we've all said, this is about patient participation. So I'm going to hand over straight to David, who's doing a fantastic job following the questions on the chat. David, let's go.
All right, we've got several questions in from the audience. One, I'll just note, because that's administrative. Someone asked, because so much information was just presented, whether this information will be available later for them to re-review and take notes, and the answer is yes. This material will be live or will be provided online for 90 days, so you'll have plenty of time to re-review any of the sections.
And David, just worth reminding people, Silvia mentioned it, we are producing a patient version of the paper. The real paper is very technical, and believe me, it's hard to understand. We have, for those of us who don't understand it, a patient version that will be coming out soon as well.
Excellent. And so the first question is kind of two questions in one. So let me break it into the two pieces. One of the issues it gets at is the question of how is this paper going to be updated as new techniques, new drugs, new procedures come online? And the focus of the question is really interested in looking at making sure that insurance coverage exists, because papers like this can influence, especially in the United States, whether insurance carriers will cover a procedure or not based on whether it's accepted by the field.
So I start, then I give the word to Robin. The consensus paper needs to be updated frequently based on the new data that we have in the disease. And of course, it's not easy to say how often, because it depends when we have new compounds and new data. But for example, there are already new papers showing better, which is the role of the less frequent translocation. Then there is an effort about collecting data on transplantation. Then there are new compounds coming out. So of course, as a group, we feel the responsibility of updating the list of these compounds, so that even though drugs are not formally approved, at least this document can be used to show that physicians, oncologists, experts would like to be able to use a new agent for patients. So, I mean, the promise is yes, of course, we will update it.
Yeah, I agree with Silvia's answer. And I think this was an excellent question with particular reference to the United States and insurance coverage. One of the things to highlight is that the NCCN guidelines are updated regularly in the United States, and they certainly carry a lot of weight with the insurance companies. I remember when I first started working there, I would prescribe medication and the insurance company would query it. And then I'd say that the treatment was included in the NCCN guidelines, and the box was ticked and the approval went through. So a lot of the members of the consensus statement are also on the NCCN guidelines, and I'm sure with both of those it will be possible to get insurance coverage, if that answers the question.
Yeah, and then so sorry, please go ahead.
No, similarly in Europe, many of the participants to this paper are belongs to ESMO. And even though rules for using compounds in Europe is different, at least we can have those drugs listed also in the guidelines. So we need to work together, to stick together, to try to have this compound available and eliminate barriers with regard to access to the drug for our patient.
I think also this is where our patient community can add a lot of help here. And the example I would use is IRE ablation. We are seeing some startling positive results in America with IRE ablation of liver tumors. And Dr. Narayanan has just produced a paper in the last couple of months highlighting the efficacy of this treatment. That's not available on the NHS in the UK, for example, because it's not been approved for EHE. But that paper, I think, opens the door for us to go to whoever it is. And I have to be honest, I'm not quite sure if it's NICE or someone else, to say, how do we get this approved? And getting it into the ESMO paper might be a key component of that. So I think this is, and we know that because we're the patients who are watching this happening. And so we can bring that to Robin and Silvia and others and say, look, here is this, can we move this forward?
Excellent. And that actually covered the second part of the question. The second part of the question was specifically directed to IRE. And I think that's a good example of something that would be looked at for the next update. The next question that came in relates to whether this group is interacting with other organizations that are involved in directing patients to particular healthcare facilities or doctors. And the specific question relates to Europe and whether the group is interacting with organizations like Eurocan.
Yes, of course, and in particular with this regard with you and the EHE Foundation UK, we are planning, and Robin, I mean, within or without EU, we are planning to start with, I think, a very important project, a registry, a prospective registry involving several Eurocan sites. So I think that, yes, we really want to work together. What to me is very important to have I
think we've lost Silvia.
the EHE Foundation website with expertise in the disease can be found. I think that this is very important.
Yeah, I think in many ways that sort of collaboration is really a no-brainer, basically. So I totally agree with Silvia's point.
And then there was a question about translation, and specifically wondering if this is a version of this is going to be available in German, but maybe we can answer more generally about what the plan is to disseminate this in different languages.
Yeah, I mean, of course, the idea is to translate the first English version into several different languages, including, I don't know, Chinese, not only German. And for that, we need a collaboration with people from all different countries to make the document comprehensible, but clearly, is to share a good quality information. And we know that often it happens that the patient takes this to the physician. And I mean, for that reason, to have the live version is so important.
Excellent. Well, sorry, go ahead, Hugh.
I was just going to say, just at the moment, David, we are expanding or just in the process of expanding out to a European network of EHE patients. And Mariana Coutinho in Portugal is leading that charge for us. And we are discussing this language issue because I think one of the key weaknesses of everything we do is that it's in English. And so there is a community of EHE patients out there who can't participate because they don't speak English. And that's it's on our agenda, but it's quite difficult and time consuming to get it right. But this paper is a great place to start. Just getting this paper translated for patients and clinicians in other countries in their own language would be a massive step forward, I think.
Excellent. Well, we're at time for this session. I want to thank everyone for their time, and we're going to move on to the next presentation, which is a video presentation.
Thanks, guys.